For those of you who don't know me, for the three of you who don't know me, I guess, I'm Norm Thurston. I'm the Executive Director here at NAHDO, the National Association of Health Data Organizations. And I have with me Charles Hall. You can see Charles on screen, who's our Director of Projects. He has helped to organize this session today. I will be the moderator, and we have some panelists that we're going to introduce here shortly for our topic today. But before we jump into that, we want to give a shameless advertising plug for our annual in-person meetings and networking sessions, May 7th to 8th in Austin, Texas. If you are not registered, we encourage you to do that. The early bird deadline is coming up soon. It's on April 6th. So make sure that you reserve your spot today. Last year, we ran out of space, so the people who waited towards the very last few weeks didn't actually get to come. So if you want to come, we've got extra capacity this year. We think we'll be able to accommodate everyone. But if you could please register early, and that way, if we do look like we're going to be tight on space, we can work with the hotel to see if we can get even more space. So we're excited that that's coming up, and it's going to be a great opportunity for you to meet people and network with them, and for us to continue the conversation similar to the one that we're going to be having today. So today, our topic is understanding how state and federal legislative action might be or might have already impacted state health data programs. So we will just tell you already, two of our panelists are not going to be able to join us because they have active issues going on with their programs that would preclude them from speaking publicly about what's going on. So we will, unfortunately, Lori Garrett from Washington will be not able to speak today, and Stefan Gildemeister has the same issue from Minnesota. But we do have fantastic panelists with us today, and we're going to split our discussion into two segments, one about state options and state activity, and the other one relating to federal activity. We fully expect that this will be very interactive, that they will speak from their perspective, from their states and their programs, but many of you will be online and will have experienced different scenarios or different impact on your programs, or maybe no impact from your programs. And we'd love to hear about that as well. So please be aware of that. What we will do when we get to the Q&A session, we'd like you to put your questions in the chat as we're moving along. That makes it easier for us to kind of moderate and curate those. But as we move along, we'll watch for those. If you don't have chat, sometimes people say, I don't have chat. It's not enabled on my version. We understand that. If that is your problem, just raise your hand and we will make sure that we get to hear your questions and your comments. So with that, Charles, let's go ahead and invite Kenley and Kristen to turn on their cameras, and I will introduce them. So Kenley Money is NAHDO's board chair, and she is from the Arkansas Center for Health Improvement. I often think that I stands for information, but they had more aspirational goals than just providing information. They're actually going to improve health. So Kenley is with us today, and she'll be speaking as part of our first panel. And then Kristen Paulson is the CEO for the Center for Improving Value in Healthcare in Colorado. Kristen, if you can turn on your camera. And while that's happening, I'm going to just ask each of them to take a couple of minutes and from a state perspective, answer this question. How has your state's most recent budget cycle affected funding for health data initiatives, and what specific legislation from your state's recent session will or might impact healthcare data collection, reporting, or analysis? So we'll go ahead and have Kenley, if you want to take the first crack at that, that would be great.
In the session this season, we still have about 3 weeks to go. It's spring break week right now. There hasn't been a lot of activity about budgets for health data programs like the Arkansas Department of Health or DHS, save the focus on Medicaid, but that's not health data necessarily, or public schools like University of Arkansas for Medical Sciences, UAMS, which is where ACHI is. And so that's very good that the need for energy hasn't been there. Other things that have happened, there hasn't been a lot of negative energy either in focus or forcing or changing the collection of health data. because it's health data, there are some pressures in and around the legislature this year about entities, but has nothing to do with the data collection. But ACHI, to our good fortune, is named in a bill this year and the Health Data Initiative, which is our APCD, is named in a bill that is going to go up to vote. It's doing very well, and it's getting a lot of positive feedback because it has to do with non-claims payments from PBMs. That's one. And then there's another one that has to do with tracking the primary care workforce using our data as the primary tool to do that. And then additionally, though it doesn't name us directly, our new governor had for the past, well, I guess it started back in the fall, a big initiative on mother and child health, maternal health. And at the same time, ACHI had been doing a big push on maternal health analytics to disseminate throughout. That's part of our mission. And we do have some core funding to do these types of analytics and research to be externalized to improve the health of our Kansans. And so, as luck would have it, or perhaps it was a vision informed by a little bird, I don't know, but we began our push to provide health analytics at the same time that the governor did. And the governor invited ACHI to participate in all of the workshops that she ultimately, the information out of which she ultimately used to build her big plan. And that was announced on February 6th. And it was called, stand by, it was called, I'm getting there. Sorry. The Healthy Moms, Healthy Babies Act. And that is going to put a lot of focus on Medicaid. There's almost a push me, pull you there, but the governor supports this, and to provide more resources in the environment for moms and babies. So while we were not named in that, we were key information providers at the table. So on those two fronts, most specifically, the health data collection in the Arkansas Transparency Initiative and the APCD was considered to be very, very valuable and has helped minimize threats. Okay.
Great. Thank you. Kristen, would you like to take a crack at that same question?
Sure. So Colorado has some interesting funding mechanisms for running the budget in the state. Complications from something called TABOR that make balancing our budget a more challenging thing to do on a year-over-year basis. This year, going into our next fiscal year, Colorado is facing just shy of $1.2 billion shortfall on our state budget. And so there have been a lot of very hard decisions that have had to be made across our state. And for the last several months, our funding was part of that. So we receive approximately $4.4 million a year from the state of Colorado. And that much of that money is used to match to federal funds. And so I can actually say that as of Friday, we just found out Friday, we are getting partial funding for next year. So I want to say thank you to all of you who have reached out and helped us really establish the value for the organization. It's been a bit of an uphill battle these past couple of months. So luckily, we do have partial funding for that. We are going to have to absorb approximately a $1 million cut to our operational funds. We're trying to ensure that doesn't hit the federal match dollars that we're able to draw down at the moment. But that's what we're having to figure out over the next year here. And so I don't know if there's necessarily been any impact on data collection, but certainly just the existence of the APCD was in question for quite some time. And it really was not an issue of value so much as just available dollars. But it did really push us to be able to define our value as an organization much more clearly to our legislature, to the people we work with. The Colorado APCD has written into about a dozen pieces of ongoing legislation where we have reporting responsibilities throughout the year to different entities and for different purposes. I think part of the reason why we were able to maintain funding and establish our value is really because we are involved in so much, and it would be very challenging for folks to be able to eliminate, or for folks to eliminate that source of data. There are a couple of pieces of legislation that are moving through the state right now, which may implicate the APCD, or in which the APCD might be brought to the table as a source of data provision, but also kind of a neutral collector of the data. We have a lot of fairly spicy pieces of legislation that are moving that have a lot of political heat around them. And the APCD is one potential space to be housing data or to be reporting data that's seen as fairly neutral and reliable. So that is a possibility this session. But for us, the big challenge this session was really around just the funding in general. Our statute also has a provision where if funding is not available for the APCD, the data has to be destroyed. And so for us, the funding question is really a viability question. There is no, sort of limping through for a year. If we don't have the state funding, if we don't have adequate funding, we do have to destroy the data. So that has been our challenge this year, less on the administrative or on the legislative side, but more on just the funding and budget side of things. So managed to make it through. We have funding for next year. Thank you, everyone. But that's where we're sitting right now for the legislative session.
Okay. It sounds like that you've both had some interesting times at the rodeo, if you will. So let me just ask a kind of a different question then. Are you aware of any new state mandates or reporting requirements that, and maybe it's just recent ones, but anything that's new coming your way that your state officials are asking you, hey, we would like to see the data be used in this way for this reporting requirement and for that way? Could be anything, insurance, could be public health, could be anything. But Kenley, have you heard of any new state mandated reporting requirements that are coming your way?
There are, yes and no. I can't say that they are mandated yet, but there is a bill in the works right now, Senate Bill 264, that establishes the Primary Care Payment Improvement Working Group that will define primary care, evaluate dollars spent on primary care for both Medicaid, commercial, Medicare Advantage, et cetera. And it would include non-claims-based payments, and the APCD would be the foundation of that. And additionally, there is a bill, and I don't remember what the number of it is, about PBMs. I don't know how everyone likes to think PBMs are the big enemy. And so I'm not sure if that is actually going to go through, or maybe they're going to save it. I'm not sure. But it would use APCD data at its foundation too.
Okay. Kristen, anything coming your way from state mandated reporting?
Not that we know yet. We actually so our cycle for doing updates to the reporting requirements actually is finalized in November of each year. So we're just going into the implementation of last year's approved updates. So we'll be doing more outreach in the coming weeks and months, working with folks. And then it will also depend on which bills move through the legislature and whether or not they decided to integrate APCD data in there. But it's kind of TBD for us at this point in time.
Okay. I also want to point out to our viewers that we have with us two great examples of how to demonstrate the value of your program to the state budget decision makers and those who control the purse strings and other decisions. So maybe could both of you just comment briefly, and we'll start you with Kristen. What do you think were some of the things that worked in terms of communicating your value to the policymakers so that they didn't just say like, oh, just get rid of the whole thing? What works?
It's been a little bit of a trial and error, I have to say. It really for us came down to a lot of individual priorities for the folks that were on our joint budget committee making those decisions. We enjoy strong support from the governor, which was fantastic, but we did really have to make sure that we were establishing that value proposition for the Joint Budget Committee. Two of the folks in the Joint Budget Committee are longtime and very vocal supporters of CIVHC and the Colorado APCD, and the other four really either didn't know much about it or really did not have a true understanding of the value that we bring. And so it really was a bit of a trial and error. For one of the members, the key turned out to be, how is this impacting practice? How are providers actually able to benefit from the research, from the work that you do, from the work that folks do with your data? And what is that sort of on the ground impacting patients value proposition? For another, it was, where is the overall system cost savings that's able to either be identified or be created through the programs that you support. We are lucky enough to be able to be involved in things like the Colorado Option Plan, which are low-cost health insurance plans on the exchange. And there's been some recent research around that demonstrating that those plans are saving not just from their plans, but are also pushing down premiums for all plans on the exchange. And those rates come from data that CIVHC provides to our Division of Insurance. So we're able to paint a fairly straight line between CIVHC, our data, and what we're able to do for the state and saving consumers dollars. For another person, it was the fact that we help support some current efforts around youth and child mental health services, and that we are, able to do a lot of work to actually increase information into access and where we have deserts in terms of provider availability, things of that nature. And so it just kind of varied from person to person. And then the fourth one honestly came down to, we had a lot of supporters in his district who were very, very vocal and reached out to him several times to say, like, this is important. And he basically decided that if it was that important to his constituents, it's going to be that important to him. But it really was a bit of a trial and error, because there are a lot of different ways to capture the value of what we do within the state. Whether it's within our communities, in the research groups at our, facilities and provider hospitals, or whether it's, to the state directly. And it depended on us being able to articulate all of those different value propositions.
Okay, Kenley, how do you demonstrate your value to your stakeholders?
It is almost exactly the same as Kristen described, and you have to be able to look forward and read between the lines and know who your fans are, know who your stakeholders are, and there's a bit of a magic ball there, a crystal ball, to see, okay, what's going to be the hot topic. When we worked on the maternal health project alongside the governor, that was almost serendipity to be able to demonstrate that value. And the stakeholders all around, pro and con, saw and valued the input and the information and we did try to keep it on track a bit in a nice, subtle way that made, knowing your stakeholders, knowing who your champions are, and putting in our office, we have a team of 1 or 2 people, and they are on Capitol Hill. They're on Capitol Hill all the time, and having FaceTime relationships and face-to-face relationships with the legislators. And that has proven to be incredibly invaluable.
Great. Well, we've got time for one more question, and then we'll come back at the end when we've got time for more questions. But I just want to bring this question from Jeff Lines through the chat. He would be interested in the flip side of the prior question. Have you seen anything in your states about guidance of things that you should stop collecting or reporting on? Is there stuff that they don't want you to be dealing with right now, or is that not hit your states yet? Kenley, why don't you go first?
I'll go. This year, we will have to do a data submission update. And some states do it more often. We do it about every 3 or 4 years. Our goal is to align our data submission guide with the CDL. And the CDL includes, at this time, of many different values for gender or sex. And so when that happens, it is entirely possible that we will be asked not to do that. That I anticipate. So no one said anything so far, but change is coming and we'll see. We'll test the boundaries.
Yeah, good. Okay, Kristen?
We do data submission guides updates much more frequently. We do them annually. We have not necessarily received any guidance to reductions in the data that we collect. We have certainly had been making much more intentional decisions about the kind of reporting that we publish. We, a few years ago, published a report on gender affirming care in Colorado that was supported by our state agencies. And we had prepared an update to that report, and we have removed that report from our website out of an abundance of caution. And we did have an advocacy group and the state reach out to ask us to take that down. So we have done that, but to date, that's the only sort of action we've taken in terms of changing what we're doing, changing our reporting. But again, we're taking a very critical eye to any upcoming reports as well, just to make sure that we're not going to be, potentially causing more harm or creating the opportunity for harm. Obviously, our goal is to support and improve the health and healthcare of Coloradans, not to put anyone at risk. So we're being more cautious, certainly, but the only actual impact so far has been on that one report.
Great, thank you. All right, we're going to take a shift here just for a second. We're going to bring Kyle on the screen, and we're going to talk about federal stuff. So we'll come back to the two of you in just a minute. We'll bring everybody back at the end. But let's see if I can figure out how to do this. Maybe Charles can help me unspotlight Kristen and Kenley while I talk with Kyle. But Kyle, let me ask you this question. With the change in the federal administration, what changes have you already experienced? What do you perceive to be potential concerns, opportunities, and challenges coming in the next year or two? And how are you preparing for all of that potential change?
Yeah. Good afternoon, everyone.
I should have introduced you. I forgot to introduce you. This is
no, it's okay.
Go ahead and introduce yourself.
Hey, everyone. Kyle Russell. I'm the CEO at CIVHC. Virginia Health Information. We are the state health data organization and health information exchange for the Commonwealth of Virginia, and we're a private 501c3 organization that has served the Commonwealth since 1993. So our 30th anniversary was 2 years ago. And so I mentioned that we serve both roles. We're much more traditional, or we've traditionally been the APCD and the administrative data collection system for the state much longer than the health information exchange side. And I will tell you that has been an eye-opening experience, in that for the programs that we've traditionally operated, and APCD being none bigger than that, federal funding was not a primary source for us at all. And we were very much looked at as, well, what % of your funding comes from private fees and sales versus state funding? Federal funding didn't even come into the equation. But then when we started operating health information exchange, it became clear to me that that is the #1 source for how you run those systems. And it was clear to me essentially how much more of an ecosystem there was in strategy around maximizing federal dollars and the shifting landscape for that there was for health information exchanges versus APCDs. And even that, there was a little bit of a disruption a few years ago with the end of high tech and switching to MES, and there having to be more state collateral put up. And even that small adjustment was disruptive for the industry. But it was just so clear how much more it was being leveraged, and it seemed like such a obvious opportunity for APCDs, who I know have started to leverage MES a lot more in recent years, but also for hospital discharge systems as well. And so towards the end of 2024, I would have told you our number one growth strategy would be leveraging MES and federal programs that are very standard for health information exchanges, and doing that on our administrative side of the house, and say, like, this is a clear playbook. Like, we are not utilizing this as much as others and as much as we could. And that's how I felt at the end of 2024. And then obviously things have shifted quite a bit. And of the different federal sources available to APCDs and state health data organizations, MES funding has not gone away, but there's certainly a heightened level of concern that there will be changes. And I don't think anybody, I mean, clearly everyone sees in the news that there's potential cuts to Medicaid overall, and some of those recommendations include a cap on the administrative match rate, and which would impact those programs. And so I think, at first that was the primary thing that we're looking at. I'm like, well, what happens if that changes? I will localize to Virginia and say, we don't get a ton of money through that program for APCD right now. Like I said, that was one of the things we're actively trying to change, but we do on the HIE side. Now, luckily, we do have clauses that state that if federal funding for that program goes down, then provider fees go up. And so there is a little bit of a valve. We would take a little bit of a hit, but there is some backup there. And for better or worse, we haven't leveraged it enough on the administrative side to where if it went away, it would be annoying, but it's not like we kind of never got to build the ecosystem around it, or haven't yet. I'm hoping that still stays around and does it. But so that's very much like a wait and see, I think, of like, it hasn't changed. I think there's all kinds of advocacy going into this. Certainly when it comes to Medicaid shifts, we're a very small fish in a large pond of people that do not want those cuts to happen. And even within the administrative match rate, I would say state health data organizations are a very small fish in a large pond of organizations that don't want that funding to go down. But it's obviously something that we're continuing to monitor and say, if this happens, what will we do over here and there? But then a much more kind of recent adjustment, and I think many on the phone may be aware, and I know some of the ones that couldn't be on the phone today are aware that a lot of states still had COVID modernization money left, and they were actively working on kind of the final set of projects that they would do with that money over the next couple of years. And that money, I can speak for Virginia, but I think everywhere else that I'm aware of, that money has been rescinded. And so there are a lot of state health departments, I don't think it's been but so widely reported, that are really hurting. It's terrible. And I know we haven't seen the impact on that on the state health data, the administrative side, as much as we've seen on the HIE side, but I mean, there's a large impact there. And so again, for us right now, it's mainly taking away opportunity. It's not so much cutting back what we're already doing, but saying like, oh, we were going to do this and this would be great, and now we've got to pivot and adjust, which we will do. And there's still other programs and different things available, but like it does make life a little bit harder. But I do, I guess, want to say in closing that I figured almost all of my update today would be negative. And it's a tough time right now for a lot of organizations, and a lot of organizations that have been hit harder than we have. And I really feel for it. And I feel like, I hope our community comes together to support everyone as much as we can. But my hope is that there are some changes that come out of this. If there are more significant cuts or restructuring, even though there may be a net reduction in funding, I think a lot of the funding mechanisms right now are terrible in how they're structured. Like the CDC funding and a lot of how money goes to health departments being so siloed into specific diseases and how chopped up it is, I don't think anybody at the state level likes that system. And I don't think it's helpful for state health organizations to support that in the way that it's set up. And I think a change there could actually be good for us. And I feel similarly about the Medicaid system, to be honest. The way that APDs are set up and like the whole cost allocation, like there's a lot of things with that you play the game that's in front of you to support your systems. And I fully support everyone doing that. But it's not how you would design it to start. It's strange. It's very gamified. Like I don't really love it. But so I would certainly take money from it above having the funding be cut. Don't get me wrong. But if that changes because of that, there may be some good things that come out on the back end. So, but I know, like I said, I can't see everyone on the phone today, but I know a lot of us are kind of just getting through it, head down, you kind of survive through it. But I do feel like, particularly to what Kristen covered on, like if you can get through this funding environment, you are strong. Like, I mean, it's like it is really a test to say, like, are we doing something that's valuable? And it's like really getting pushed and say, like, no, like there's so much value that even when funding is being cut around us, like we stay strong and we operate and people see that, like that's really a testament to longevity. So I really am so impressed by that, and am happy for the success everyone's still having.
Great. Let me just ask you the kind of a different aspect of this. What opportunities do you see for possible federal state data collaboration coming down because of the administration's emphasis on data sharing and data opportunities? Do you think that's going to trickle down so that you will have some benefit from this, or is that just maybe still out in the ether and we just don't know what that is?
I certainly don't feel like I know. I can only pontificate. But I think that I can certainly see a scenario where there's more emphasis at a state level, which may not be a better way to design the system, but inherently, if you are supporting an individual state, having more flexibility is not bad. So in terms of like our own interest, I don't think that is that may not be a bad thing. And yeah, I would say there's a lot of norms and structures that have been viewed as monoliths that will never change that are being changed. And that's predominantly the predominant focus is on things that we don't necessarily want to change. But like I said, I think it's fair to focus on things that we do want to change, that maybe to take advantage of too. And so I think in a very shifting environment, like there's always opportunity that comes out of that. Like when you feel stuck in something, like I said, there's certain roadblocks I think we've all hit, and we don't need to go into that now, but like maybe the climate around that changes when there's a lot of change. So yeah, I'm always a firm believer that like change and uncertainty can be unsettling, but typically leads to unexpected opportunity too.
Yeah, and this is crystal ball and tea leaf time, but
yeah.
Do you think?
Do I have to do this alone? I don't know.
Yeah.
Like, can I?
Yeah. You have to do it. Yep. Well,
yeah, or whatever. That's fine. It's recorded, right? Who cares?
That's right. We'll bring Kristen and Kenley back at the end if you don't want to do this. But
no, it's okay.
One of our big concerns, as from the APCD community, has been finding a solution to the ERISA issue. Do you think that the possibility under the current administration exists that we might find a solution to the ERISA data collection issue, or do we have false hope, or where do you think we are on that one?
I hope so. I mean, I feel like there's some different grassroots things going on. Like, I don't think it can be any slower or more. I mean, like, there's only one way to go, I think, for that. So, do I think that like it'll automatically go through? I don't, and I doubt anybody on the phone does. But there may be some that know more than me. But I would be optimistic just in the sense that like I don't think that can be that can only improve. So that's what I would say.
It couldn't get worse, right? It's already as bad.
That's right. I don't think it could get. I don't think that can get worse. Yeah.
All right. Well, let's go ahead and bring Kristen and Kenley back. Charles, if you can spotlight them and bring them back up, and maybe we'll let you just. I mean, you weren't here to talk about federal stuff, but that's kind of a crossover issue. ERISA data. Do you think it could happen, Kristen? Is it a possibility?
Oh, I do. I think it could happen. I mean, I think that there was momentum before. I think that it's a possibility. I mean, again, this is very crystal ball, very reading the tea leaves situation, but I think it's a possibility. I think, I don't know. We're in a strange spot. We're in a very strange spot, I think, on the federal side. So Civic does leverage those federal match dollars substantially. We use our state funds to actually receive more more from the state or more from the feds than we get from the state. So about 40% of our budget are those matched funds from various pots. And so, I mean, we've got the situation where you have a number of APCDs, a number of these health data organizations that are dependent on these federal match funds. Yet we have an administration who has repeatedly doubled down on their commitment to healthcare data transparency. These health data organizations are basically how you can get there, and yet we have funds that are being threatened to cut that are supporting them. So that we have this sort of bizarre catch-22 situation going on. But I mean, I think there's possibility for forward movement in the right directions. I completely agree with Kyle saying that, you know, dealing with these areas of change and having to look at how funding is structured, what the work that we do. I mean, that's at Civic, we are across the entire staff, really taking a hard look at, hey, what is the work that we do and where do we have an opportunity to make a bigger difference? And maybe that's how we, you know, prove our value to the feds, and that helps, you know, balance out our dollars and allows us to actually find a place where we can collaborate and find a better value proposition for businesses. And I mean, I think it's going to be challenging. It's going to be challenging to figure out what this looks like, but I don't think we are dealing with, you know, an insurmountable obstacle in the path forward. It's just going to require a lot of collaboration. It's going to require a community coming together and trying to figure out what we can do. But I don't see this as something that is going to end the work that we are all doing in any way, shape, or form. I think we can get through this and we can get through it stronger, but it's going to be challenging.
Okay, Kenley? Oh, that was, she answered a lot of questions, but the real
Yeah.
question was, what do you think about ERISA? Is ERISA going to get solved? But, or whatever you want to talk about.
My crystal ball is very, very cloudy. I can't
Okay.
begin to say if I can't even begin to guess if ERISA will change, if all that will change. There's opportunity. Sure, there's in focus from the highest administrative office on transparency. But when the rubber hits the road, I don't know. I don't know. So we here in Arkansas, we have an incredibly large self-funded employer, and we have conversations with them regularly. Haven't gotten there yet.
Yeah. Okay, well, let me just ask you some, like, these are just general questions, not related to necessarily state or federal, but just in general, how are you engaging with stakeholders to communicate change? Change is inevitable, and we've already seen that, you know, change is happening. What's the best way of kind of letting the people around you know that you're going to be experiencing some change? So go reverse order, Kenley, and then Kristen, then Kyle. Well, how do you manage that, Kenley? That letting people know that their cheese has been moved, or that their life is made better in some way, or.
Well, I would want to segment and categorize the people around you. We have advisory and governing bodies here at ACHI that we communicate with regularly in a structured manner. Like we have a group called the Health Policy Board, and it's made up of professionals throughout the community and the state, medical and private, and they have a vested in. They are the voice of health improvement in Arkansas. So what we do is work closely with them, and we bring to them issues, and then they will, as a group, create a statement which can be publicized. So it's not ACHI doing it, though we're the ones writing it. And whatever we're trying to do is backed up by them and authored by them. So I say that they are aware of change, negative and positive change that affects us and the Health Data Transparency Initiative first. And with their collected support and power, if you will, influence perhaps, that's how we can communicate and try to mitigate whatever happens.
Okay, Kristen, how do you communicate change to the people around you?
I think similarly to Kenley, you know, we have an APCD advisory committee that we work with on a quarterly basis, and we communicate with them very directly. I mean, that entire group was part of building support for APCD budgeting and reaching out to the state. Our first sort of pass at communicating change and figuring out change is obviously our staff. We have a phenomenal staff who are incredibly supportive, and really determined to find a way through this as efficiently, as successfully as possible. And then we reach out to this advisory committee and get their input, feedback, communicate what changes are happening, and get their advice on how to structure that. So, I mean, those are sort of our partners in brainstorming what these changes are going to be. We don't know the full extent of what that change is going to look like. We just found out we were going to have funding at all on Friday. So we've had 2.5 business days. So we don't have a solid plan right now. So the communication strategy is certainly not in place, but it's one of the things that's on our plate to figure out. But our first step is figuring out what our path is actually going to be, and then we'll worry about how to distribute sort of what that direction is going to look like.
Kyle, do you have any tips you'd like to add?
Yeah, I mean, I think it's hard to balance relaying information when you don't have all the answers to be transparent, but then not also comment on things where the outcome may change. If you wait until everything is totally certain, then people will feel like you have not communicated anything. But you do run the risk in an intermediate update that you either make something seem better than it is or worse. And so I think anyone that is having to do that, it's like there's no perfect way to address it. Right. I mean, I think that two things that are different about the current situation is, one, so much speculation has happened on what could change because of federal communication freezes and other stuff. And it's like, well, these things could change, but we don't know when. And so it's like, okay, do you want to speculate on what you could do if those things change or not? And then also, it's not like there are bills and this all-out attack on, like, you know what, we're going to just defund all the APCDs. It's like the entire ecosystem that we work together with. It's like the bigger community that kind of feels this sense that we're working together, and times are harder. And so I feel like in terms of outside communication, you're not, by saying like, oh, we may have to pivot or address things, it's not like anyone is not expecting that, because it's like everyone is dealing with the same thing. And so yes, I feel like that does make it a little bit different than usual versus when you feel like something is impacting you directly. But yeah, I mean, like I said, I feel like I do feel a stronger sense of community with these things happening sometimes. It's like, I don't think that we're all going to get to a bar together in 30 years and talk about how, remember when times were perfect and we had endless money and like, X, Y, and Z. It's like you reflect on the times where it's like, man, that was tough. What a journey that was. Like, we banded together and got through it. And like, can you believe, we got out of that? And so it's like, try to keep that perspective too, of like, it's a long journey and it's never going to be perfect the whole time. So.
Yeah. No, so I did have a question here for Kenley that I maybe you can shift and shape this to be however you want to see it. But Kenley mentioned some examples of key legislation that would be helpful from their session. And the question is, how effective do you feel that you are in influencing these positive changes, and what are the sort of things that you can do to influence change for good? And you could talk about state or federal, but I think state maybe is where that question was going to be focused.
Okay, well, the key to success in this regard is to be very forward-looking and thinking. Think. Okay, I don't want to be cliche. Think outside the box. But we had, for example, we noticed, when I say we, they're not my data team necessarily, but the folks at ACHI who do health policy, analytics, et cetera. This shift in focus, money, and population in Northwest Arkansas, which is where the University of Arkansas at Fayetteville is, and where Walmart is, and big Tyson chicken, big companies. And in fact, on the news this morning, they said that housing prices there were still going up, where in other parts of the country they were going down. That's how popular it is. But what they noticed was, and what our folks were noticing, was that there was lower healthcare expenditure up there, and that was strange if the population is going out. I mean, it's increasing. So with some vision and some guesses that were ultimately substantiated, it became an outward migration analysis. People were leaving the region to get their medical services. So with that recognition, a little bit of a guess, a hunch, found it, and all that did was substantiate and our credibility and our value in the state with our stakeholders, the legislature, et cetera. So I don't know, forward vision, always look forward and always look around.
Kyle, you want to go next? Like, I don't know that you have any legislation that you're necessarily needing or wanting or pushing, but just what are some of in your experience, how can you make a difference in getting good stuff, good change?
Yeah, I mean, I feel like one of our primary objectives and value adds, and it's not what I wouldn't word it this way in our mission statement, but we decommercialize access to data and make it more accessible. And so if we did not exist and the state systems that we run didn't exist, and groups needed to, like a legislator needed to ask a question and know how to structure a bill, what about this program, that, without that magic 8 ball that is ultimately accessible, and public money is used to make sure that there's accountability and keep things low cost, the commercialized version of that would be so much more expensive and unsustainable that we add value in that, making sure that that doesn't have to happen. Like, there is this guaranteed resource that is here that everyone has a standardized way to access. It's available to all. And yes, we have to figure out how to run a balanced budget, but we're not trying to maximize ROI of how this data gets out. And so that being a consistent force in the community to be, so that organizations know, like, oh, if we have the APCD, if we have these other sources, like, we know, we have the confidence, know we'll have the data to be able to do this, or we have an outlet, say if we expand that, we can do it, and they're not going to rake us over the coals and try to get as much money pumped out as possible. Like, that is a very important thing, because like I said, if it went away tomorrow and the next session people wanted to figure out how to get data for bills, they'd probably say, well, let's build one of these systems so we have all the data to figure it out. It wouldn't take long. So even regardless of individual topics, but just being that part, a resilient part of the community that people know is there to make sure that data is accessible, is important.
Kristen, any last thoughts on that question?
I mean, we work really closely with our legislators. We work very closely year round, as Kenley was mentioning, having eyes on the ground at the Capitol. We also have a team that does that. We work very closely with the legislature. We work very closely with our communities. Colorado has a bit of a different sort of state health structure than a lot of other states do. It's very disseminated in small nonprofits, and we maintain a lot of those relationships so we can have the credibility, we can gain the reputation, we have the presence within our communities across the state, and then have the folks down the Capitol Hill, making sure that we're brought in where we need to be brought in. But I mean, I think, yeah, I mean, it's down for us. It comes down to just relationship building, and making sure that we're there and able to inform where we can. We do a lot of legislative requests, similar to Kenley and to Kyle, working with legislators and making sure that we're a partner. And it doesn't matter which side of the aisle, it doesn't matter what the topic is. We're a source for evidence-based policy, and that's what we want to push forward.
Yeah, great. Well, let me just, we've got a comment here, and I'm turn this into a question for you, Kristen. Lisa mentions enhanced federal funding available through the streamlined modular certification. Is that something that you've explored in Colorado? I know California has looked at that. Is that something that you've tried?
No
yet?
idea. I have it Googled on my in my browser over here. We're gonna take a look at that absolutely, because I do not know. I don't think we've explored it at all, but certainly want to take a look and see if that's something that might be an option.
Yeah, Kyle, Kenley, have either of you looked at that yet?
I have not.
No, just MES.
Okay. Yeah, so I know that California Medicaid was able to do that get some additional funding for their APCD through that. So, all right. Let's see. I had one more question, and we're at 10, 12, well, 53 minutes. So we'll just make this the wrap up question. We mentioned earlier, change and unknown can be unsettling, but it can lead to opportunity. We're certainly in a phase, both at state and federal levels, especially in your three cases. Do you have a positive outlook or a negative outlook, or how are you feeling right now? I'm going to talk about your feelings about how things are going to turn out for you all over the next year, 2 years, 3 years. And let's go to Kristen, then Kyle, then Kenley.
Sure. Well, I have to say, I mean, I admit I may be riding a little bit on the high of actually having confirmed funding for next year. So that was our first hurdle to get past. But I'm honestly feeling it's going to be challenging. It's going to be a challenging year, but I'm feeling really good about our potential, about the opportunities that we have. I mentioned this before, and I will, mention it every time I can. We have a phenomenal staff who are bringing any and all ideas to the table. I get regular emails from various folks. Hey, I was thinking about this. I think we could really contribute value to this thing. Have we ever worked with these guys? Have we created do we have an alliance with those folks? And so really thinking about how we can pivot. It's been one of our conversations for years about what are the other things we can do to bring value to the state and to the nation, not just that connection with the state agencies, but where else can we really bring value? And we've got some really brilliant ideas about what we can do quickly, what we can build towards. And so I think there's a lot of positivity, even in the face of the challenges that we have. I think there's a lot of positivity from the staff, from our executive team. We're pulling together a map to continue moving forward. It's going to look different than we thought it was going to a year ago, but we're finding a way through, and I think we're going to end up just to echo sort of what has been said this whole time. I think we're going to end up stronger in the end than we are now, even though this is going to be a tough period. I think it's going to end up being something that we can really grow and develop through. Yeah. So,
Kyle?
Yeah, I agree. I mean, it will be harder. That doesn't necessarily mean that that's bad. But I do think that we have to work harder, take more risk, operate more like a business, even if it's just to keep baseline for what you could have just gotten public money before. Yeah, I think that, at least in the short term, I do think that that's likely, but that those may result in more resilient business models. Just because something is cut right now doesn't mean that it would have lasted forever. So I think a push towards saying, like, how do we make sure there's accountability measures, operate like a business, make things market tested for things that we need to do. That's not a bad long-term prospect to how to make sure the organization's structured in a way that is serving others. So, but do I think that it will be harder to do that than it would have been otherwise? Yeah, absolutely. But I also feel like I do feel like some changes we are dealing with now would have happened at some point anyways. And so it's just kind of speeding that up a little bit, and and we'll be resilient and get through it. But there is still plenty to be optimistic about. And I think there will be some new unique opportunities for states and regions and locally focused organizations that might not have been before.
Yep. Kenley, concluding words.
Kyle almost spoke long enough for me not to have to do this. I can't remember a legislative session. I've been at ACHI for 15 years. I can't remember a session where there wasn't a target on our back. And what do you do about it? You have you have in your pocket your elevator speech about value prop, and you look at it often and you update it often, and everyone has the same message. Yeah, I'm optimistic about the future. I don't mean to diminish the pressure that's out there. It'll be hard. It's always
49
hard.
Street, 916-764.
It's always hard, but we'll be resilient, as the chat says. It will
That's
be
right.
okay. It will be okay.
It will be okay. And I think that's, like that was the word that I thought of after all of the comments. Like this was a webinar about resilience, right? That's what it was we're coming back stronger, we're coming back better, and it's everything's going to work out, even though it's going to be hard and painful. It'll work out. And maybe even be better. Who knows? So, all right. Well, thank you, everyone. Thanks for your time. And we will have this available on our YouTube channel later this afternoon. And we look forward to seeing so many of you in person in Austin, Texas, May 7th and 8th. Yay. See you then.
Thank
All right, bye-bye.
you.
Great.
Everyone.
Thanks, everybody.
Thank you.